All right, everyone, we've got a lot of stuff to cover. We're going to pick back up where section 2 just left off, so the self breast exam, by taking a deeper look at breast cancer. So, what is breast cancer? This is when we see a malignant tumor that starts to form from cells in the breast tissue. A malignant tumor is just a fancy way of saying it's a group of cancerous cells that will invade surrounding tissues and potentially spread or metastasize to distant areas of the body. Remember, metastasize means if we're talking breast cancer, it can make its way to the brain, the lungs, the heart, etc. Uh, breast cancer almost entirely occurs in women, but men can get it too, and we'll talk about why in a moment. But hint, it's estrogen. So, risk factors as a whole are anything that makes someone more likely to get any particular type of disease. Having one or more risk factors for whatever we're talking about, prostate cancer, kidney cancer, what have you, doesn't necessarily mean that you're going to develop that type of cancer. However, um, some back up to that would be most people with about one or more risk factors technically never develop cancer. And most people that have no known risk factor other than being a woman and growing older, in the case of breast cancer, end up producing it at some point during their lives, which is relatively scary. Each type of cancer has its own unique set of risk factors, so let's dive into breast cancers. First of which is gender and increased age. These tie in together because, well, being coded as female means you have a primary sex hormone of estrogen. Estrogen is the number one risk factor. And then as we continue to age, the body continues to be flooded with more and more estrogen. So the older you are, the more buildup of it you have. Other risk factors include personal history of breast cancer, family history of breast cancer, genetic factors, race and ethnicity, dense breast tissue, menstrual periods, having children, the type of oral contraceptives you use, postmenopausal hormone treatment, drinking alcohol, obesity, as well as physical activity. So let's look at the risk factors we can't change. First of which, gender. If you're coded as female at birth, that means that you have more estrogen present in the body, unless you decide to pull a Caitlyn Jenner and transition from one sex to the other. You are going to be at a higher risk than males. Males, however, can develop breast cancer because they produce really low levels of estrogen. But it's 100 times more common in women than men because, well, it's our primary sex hormone. Age, as we mentioned, the older we are, the more estrogen we build up throughout our lives. Here are a couple of interesting tidbits. 1 in 8 women who develop breast cancer are younger than the age of 45, whereas 2 in 3 are the ages 55 and older, just to give you an example as to how age plays a big role. Other risk factors, personal history, meaning if you've had breast cancer in one breast, it increases your risk 3 to 4 fold of developing breast cancer in the same breast, but in a different area. So if you had mass of cancerous cells in the lateral side of the left breast, you might develop it on the medial side of the left breast, which means this is a difference from the first site of cancer. Family history. If you have someone close to you, particularly what we call a first degree relative, you have an increased risk for breast cancer. First degree relative meaning they share a bloodline with you, a mother, a sister, a daughter. If you have two of these people that have breast cancer, your mom and your sister, let's say, your risk increases threefold. There is also an increase if you have a father, brother, son. However, the increase is not as extreme as it would be if those were female siblings, mothers, aunts, whatever. You also can't change your inherited genes. In fact, 5 to 10% of breast cancer cases is thought to be genetically linked or inherited. And we're talking about a link to a mutation of the BRCA1 and BRCA2 gene. In fact, it's the most common and the most studied. This is where we see healthy cells that make proteins to keep our cells from growing abnormally. Unfortunately, stop functioning appropriately. Up to 80% increase in developing cancer is seen in women that have this genetic mutation. And most often, interestingly enough, this occurs in a really specific population of women, the Ashkenazi Jewish women. However, any race and any ethnicity can develop breast cancer, which leads us to race and ethnicity. White women are more likely to develop breast cancer, but African American women are more likely to die from it. This could be because of the disappropriate nature of healthcare and socioeconomic status. Also, will tie into the Asian, Hispanic, and Native American women who have a lower risk of developing it as well as a lower risk of dying from it. This could be just disappropriating factors. Type of breast tissue, specifically dense breast tissue. If you have dense breast tissue, it means you have more granular tissue and less fatty tissue, and granular tissue puts you at higher risk simply because it makes it harder to see on a mammogram. So if you were trying to screen, it might go unnoticed. That's not to say it increases your risk simply because of the tissue type. Granular tissue is relatively hard, whereas that fatty tissue, well, it's fat, so it's going to be much more soft, much more malleable. Menstrual periods, also, we cannot change. Starting your period early and going through menopause later prolongs exposure to estrogen, so this ties into that age. If you see a woman who starts their period early and ends it late, they're flooded with more estrogen for a longer amount of time. Things we can change, however, having children. Women with no children or who had their first child after 30 or at the age of 30 have a slightly higher risk. So, guess what, guys? That means I've got higher risk. The reason being, pregnancy reduces menstruation, which alters the flooding of estrogen. Breastfeeding is also seen to have a link in lowering one's risk. What's interesting is breast tissue is designed to mature to produce milk. So, the longer you go without allowing that breast tissue to mature, the more those cells are going to replicate and the higher the risk that they'll replicate abnormally. Oral contraceptives. These increase the amount of estrogen within the system. And again, estrogen is the number one risk factor, so we increase risk. However, some oral contraceptives are estrogen free, so that might be something you look into or attempt to change. Hormone therapy obviously ties into supplying the body with estrogen and therefore increases the risk of both developing and dying from the cancer because estrogen is the number one risk factor. We can change alcohol consumption. Risk increases with the amount consumed. One drink a day can increase your risk slightly. However, it's scientifically noted that 2 to 5 drinks causes a 1.5% increase in risk. However, I would argue that also increases your risk of becoming an alcoholic. But hey, obesity. If this takes place after menopause, this has a slight increase in risk simply because fat tissue produces small amounts of estrogen. Estrogen, number one risk factor. Exercise can lower the risk of both then obesity and breast cancer. However, evidence varies as to how much it technically lowers breast cancer in particular. These risk factors are uncertain, controversial, and unproven. In fact, I think they're hilarious. So, a lot of studies are done. So, I'm going to show you all of them and we're going to take a look. So, diet and vitamin intake, antiperspirants, bras, my favorite one, breast implants, chemicals in the environment. So, diet and vitamin intake. As you can see, there are no clear results found. Antiperspirants also have found no increased risk. Bras, no scientific basis for the claim other than the people that want to burn the bras. Huzzah, female power, whatever. Breast implants, these technically do not increase risk, but similar to the granular tissue, this can make it harder to see masses of cells inside the breast during a mammogram. And then chemicals in the environment, I think these are just important aside from breast cancer. But again, there's no clear link to plastics, cosmetics, personal care products, pesticides, increasing risk. We also see tobacco smoke and night work. Tobacco smoke remains controversial because the theory is the lungs are close to breast tissue, so if the lungs are impacted with lung cancer, it can metastasize and reach its way to the breast. Does that mean you develop breast cancer? Jury's still out. And then night work. This I just think is hilarious. They're claiming that people like nurses or firefighters, police officers that live a reverse life or a nocturnal life, right? They're awake at night, asleep during the day because of their careers. There might be a link. However, as you can see, no studies have shown a link, so more needs to be looked at. Risk factors in men. Again, this is associated with the hormone estrogen, but it's produced in really low levels. Other risk factors include age, family history, genetic mutation, Klinefelter syndrome, which means you have more than one X chromosome. One more X means more estrogen. Radiation exposure, liver disease, which affects hormones and their breakdown, as we saw in the digestive system. Estrogen treatments, obesity, testicular conditions like having an undescended testicle, mumps, or both testes have been removed, and certain occupations, particularly those that have increased temperature to the genitals. So let's look at stages of breast cancer. Stage 1 is typically uh, described with a 2 centimeter tumor or less, and the tumor or the mass hasn't spread to the lymph nodes in the body, which means that tumorous mass is still located within the breast. Stage 2, here's where things get a little convoluted. If any of these apply, this would make someone located within the stage 2 bracket. So if a tumor is larger than stage 1 but hasn't spread to distant areas of the body, you have stage 2 breast cancer. If the tumor is 2 to 5 centimeters and it could have or couldn't have spread to the lymph nodes under the arm, if the tumor is more than 5 centimeters and hasn't spread to the nodes under the arm, if the tumor is less than 2 centimeters and has spread to no more than 3 nodes under the arm, or if there's no tumor in the breast but there's a presence of no more than 3 nodes under the arm, that would categorize you as stage 2. So as you can see, it's kind of a gray area. Stage 3. This is known as locally or regionally advanced cancer. This may have spread to lymph nodes under the arm and above the collarbone. The tumor is larger than 5 centimeters and is spread to under the arm nodes, but they are not attached. The tumor is smaller than 5 centimeters, has spread to nearby nodes, and are growing into each other or their surrounding tissue. Or you'd be categorized as stage 3 if the tumor is smaller than 5 centimeters and has spread into underarm nodes and above the collarbone. So again, there's kind of a gray area and a lot of flexibility which one of these is taking place within that female's body. And stage 4. Obviously, this is the most advanced. Cancerous cells have spread to distant parts of the body, so we're seeing big metastasization like bones, organs, lymph nodes, very far away from the breast. So here's some size comparisons. 1 centimeter, you're looking at a pea. 2 centimeters, you're looking at a peanut. 3 centimeters, you're looking at like a homegrown strawberry, not these monstrous guys we can get at the market. And 5 centimeters, you're looking at a small lime. Removal of tumors. We see a lumpectomy. This is the surgical removal of the breast tumor and only the breast tumor, or a mastectomy. A mastectomy, here's where we remove all or majority of the parts of the breast. And I'm putting a nice little link here. This is a really important video. If you know of someone that's experienced these things, it gives you a kind of better view of that procedure for the women. Here is what a mastectomy would look like if it was a double mastectomy. We've removed all breast tissue, the nipple, the areola, everything from that area gone. In terms of reconstructive surgeries, we've got a tissue flap procedure where we would take muscular tissue from different areas of the body and place it where the breasts once were, or the most common, the implant procedure, which we live in LA, a lot of people undergo quite often. So I'm linking an additional video that I think is overly important. There is a tattoo artist who became renowned for people that have undergone these reconstructive surgeries. Really, you're just looking at skin, no nipple, no areola. So he's perfected tattooing those things on the female body, and it's quite magnificent seeing these women go visit him and the way that they emotionally feel better about themselves. So if you're looking for a feel-good type of video after kind of all of this relatively sad information, since we all have moms, we all have sisters, or we're females ourselves, then go ahead, watch the video. It's awesome. Hopefully you guys have a good day, and I'll see you next time.